guys, welcome back to my channel. It's your girl Telly J. Today's video is about my first year as a nurse, surviving nursing, some tips, and just gonna talk about my first year and how I survived it. Cherry vanilla flavor. It's Maya and Mika. Okay. Anyway, I have my laptop down here, so if you see me looking down, I'm looking at my computer. I made some notes so I kind of stay organized. I'm gonna try not to say like, because I said like a lot in my last video. So let's do a little introduction. My name is Chantel, but I go by Telly, so my channel is Telly J TV. I finished school in May of 2020 last year. I passed my NCLEX in August, I think the first week of August 5th to be exact. And I started my nursing job October 15th. On the floor itself. So that's a little bit of backstory. I got my first job on a PCU unit. That is a progressive care unit. It's an ICU step down and med-surg step up. So it's kind of middle ground for those who don't know what it is. I'll talk about some of the things I have seen while working on this unit, and I'll give you some tips at the end. So stay tuned if you're interested. First off, I am on a 2-year contract. I live in one city but work in another. So I travel to work about 45 minutes to an hour. So far, I love my unit. I don't really have much complaints. I think I fit right in. We have a young group of people working there. So we're all kind of around the same age group. Everyone is really like helpful and all those things. Okay, when I first started my job, I've seen a lot of, we're not allowed to discuss that word on YouTube, I don't think, before I get dinged. I'm just not gonna say. Just gonna pause right here and say I became so familiar with the testing, the diagnosing, the route of treatment, the medications and things like that. These patients that came in with this virus last year and this year would take, and that was the main thing I learned at first. That was a lot of what I seen up until January. The numbers went down. Then again in August, it like skyrocketed again. Like the whole unit was back to. Now it's October and the numbers are down a lot. We probably have maybe 5 people on a unit out of 31 bed units. We have like about 5 patients that have it. So much better. Some other things we see in general, like respiratory failure, people on high flow oxygen, BiPAPs. Other diagnoses that we're familiar with, we have patients with CHF exacerbation, COPD exacerbation. We monitor patients on telemetry. We also do blood transfusions. We have GI bleeds. We may also see patients on a PCA pump for pain. We also deal with Baker Act, like psych patients, and neural checks, like people that may have had a neurological deficit. Non-breathers, those type of things. I get not a lot of, but I see PEG tubes and G tubes. I have never placed an NG tube yet, and that's one thing I want to do. I tried on some other patient that wasn't mine, and she was so tiny. I felt so bad. I was like, never mind. I'm not gonna do it because it's hurting her, and it's not my patient. So I just left it alone. But we do have patients with NG tubes. We get a lot of chest pain people that come in on drips, like if they have chest pain or they have AFib RVR, like a rapid heart rates. We get a lot of like drips, so like Cardizem drip, Lasix drips, and heparin drips if they need those as well. So I'm used to seeing that now. It's just been like a lot of learning experience, of course. Chest tubes we see a lot of too sometimes. I shouldn't say a lot. Once in a while we get chest tubes. So like this week I had a patient with a chest tube, and it was draining a lot of blood. So for people that's not familiar, you can have like pretty much he has like blood in his like lung, so he's draining that out. And some people can have like air, I guess supposedly pus. I didn't know that till this week, so that's interesting to see. We get a lot of CWA patients, people that's withdrawing from alcohol, and we have to use a CWA scale, and like sepsis. So those are some things that we see a lot of. These patients are not as critical for ICU, but they're critical enough to be on our unit and not so safe to be on a med-surg unit. So that's kind of the patients we get. I live in an area that's a lot of older people, so the crowd is usually like mainly older. So it varies. During the spike for that thing I was talking about, we had a lot of pregnant women come in. It was really odd. I was like,
no, like this is not my specialty.
Please get these people off this unit, especially if they was critical. I had 2 pregnant people be transferred into the ICU. They start getting worse and they need to be transferred off the unit. They get transferred to the ICU. Overall, I have learned a lot. I definitely recommend anyone to challenge themselves and step up to a PCU unit. Sometimes you feel like you're not doing so much. Some days, like you're just passing meds and, you know, that type of thing. But some days patients are a little bit more critical, and I like that type of, those type of nights where we have more going on and it's not too crazy. I originally had applied and said, oh, I want to be a med-surg nurse, whatever. You know, I want to start in med-surg. I get a little bit of everything. But then I heard this facility had a PCU. There would be like more opportunity for me to learn more. So I told a lady on the phone while I was interviewing her, with her, I was like, can I go to PCU if you have a position open? I would really like to challenge myself. And she said, oh, let me take a look. And then I ended up at my facility now because there's a couple different facilities. So let's jump into some, like, just some tips I wrote down for like your first year of nursing. I definitely want to stress that time management is always the biggest thing for nurses starting off. Like, my time management skills was off in the beginning, but you get better at it. You learn what to do. You learn how to just plan and organize better for the beginning of your shift, so that way it goes smooth and you just learn over time. Don't beat yourself up about it. I know I did at first, but trust me, everyone has this problem. I don't think I've ever met a nurse that said they did not have problems time managing. You have 4, 5, or 6 patients, and not on my unit, we have up to 5, but some facilities have 6 patients, just one person. Like, there's no way for you to get everything done quick, but you learn how to manage your time. You will never know everything. Like, every day you learn something new, I swear. It can be little things like opening a freaking IV package.
It has ridges on this thing after a whole year being here. I'm just learning this.
But literally, you learn something new every single day. Ask questions. Like, it doesn't matter if you feel like you're being annoying. Someone else knows the answer and you feel safe going to them. Ask questions, especially if it's putting your patients at risk of you thinking, oh, okay, I think I got this. Just ask. It will save you trouble in the long run, and you will know for next time. I'm gonna have to finish this later.